One and a two and a one, two, three, and hello there. Welcome back to the Bleedin Truth. My name's Sally McNally. I'm the Irish midwife.
And I'm Bridget, Sally's daughter. And we are sitting together again to talk about something that's super big. It's about to happen for Sally just tomorrow morning. And I think there's nothing more important than kind of us having a conversation about it and also, hearing what your bleeding truth is of this, I guess, period of your life, right?
Yeah, yeah, it is something big in my own life. I'm going to have a total hysterectomy, bilateral salpingectomy, and bilateral oophorectomy. And all of that means all of my lady bits that are in there are coming out.
Right.
Yeah, it's a big deal because, of course, it's sacred ground for me because this is where Bridget, my daughter, was formed in my
Oh,
body.
that's right.
I don't know. Yeah, I don't know which ovary she came from, but it was one of the ovaries, and my uterus, of course, kept her safe and growing. And being a midwife, I always think of a uterus as a sacred, holy place, a velvet secret place. I think of it when I'm talking about going down on your breath in the yoga, when you're going to visit your baby, going through the wall of that velvet secret place.
Mm-hmm.
And it's such a mystical, magical environment in there for the baby, floating in lovely little jacuzzi and getting all their needs met. It's like a beautiful other world,
It's the nicest I've
when
ever
you're
envisioned a uterus before. It's really not what I think about.
all right. Yeah. Of course, my uterus has been quiet and hasn't done anything much for the last number of years.
But why are you
Um,
getting the surgery? That's the real
right.
thing to
Yeah.
mention, right?
Well, I have tested positive for the breast cancer gene 1. There's two, breast cancer gene 1 and 2, and I test positive for 1. And I've been advised by my doctor and by a genetic counselor that this will reduce my risks of developing both breast cancer and, of course, ovarian cancer, because I'm very high risk to developing both.
Right.
So I've agreed to have the surgery because I want to gaze into my grandchildren's eyes. I want to look in there. I want to see what it's like in there. I want to see who they are.
Even though there's
That's
none
that's
on the way.
Even though there's none on the way, I'm hopeful someday that
No
someday
pressure. No,
that
just kidding.
yeah, I think that was a thought in my head when I was like, do I want to have that surgery? And then I had to ask it of myself, do I want to give myself, better chance to live longer? And the answer was yes.
Of
So
course.
that's kind of exciting that I do want to live
You
longer.
definitely didn't
And
have that same perspective. Well, not about living longer, but about doing the
yeah,
surgery and if it was, something that you'd even
yeah,
consider. I think in the beginning it was a hard no, right?
yeah, exactly. It was a hard
Why do you
no.
think that
I was
was?
It was because life is really good for me right now. I
Mm-hmm.
feel strong, I feel healthy. I'm enjoying yoga. I am enjoying my work. I'm very busy. I'm enjoying teaching. I don't have time for this. It's
Right.
like it's coming at a time when it's like a bummer, the timing. Um, but I guess I had to ask myself that question: what's the alternative? If if I do have an 87% chance of getting breast cancer, and a high risk also of getting ovarian cancer, why not um, change my odds?
Right.
And maybe it's risk reduction surgery. Though I do have a fibroid in my uterus, and I do have like little cysts. on my ovaries. And ovarian cancer is very hard to diagnose. Often it's diagnosed in reverse. It's like the person's already sick and it's gone too far to do anything about, or it's diagnosed after the fact
Right.
when they're already, yeah. So I'm not scared about stuff like that, but I guess I guess I have more living to do, so I want to, you know,
Yeah, better the odds.
yeah, better the
Yeah.
odds. Yeah,
Yeah. And I mean, we don't have to go into the graphics of how they do the surgery, right? Maybe we'll talk
yeah.
about that after.
I'm okay with talking about that because I also thought about if I had a patient sitting in front of me with this same, diagnosis and high risk. Um, what would I say to her? Would I say, "Oh, don't worry about it. Get on with your life"? I don't think I
Right.
would, you know. So I had to, look back at myself and advise myself, So I actually did have one woman, a friend of mine, saying, "Why would you do that? What on earth are you thinking? Have like needless surgery." And it did stick with me for a few weeks, like needless in her mind. Why would you need to do that? But the advice that I got from the genetic counselor and from my own Dr. Crownover, who's going to do my surgery, I I felt, very convinced. When I'm telling my patients, if somebody's going to intervene in their, labor or bring an intervention to what they're doing, I want them to use their brain, right? What are the benefits? What are the risks? What are the alternatives?
Right.
What is my intuition telling me? And and then of course the N part of brain. Do I say no, not now?
But then, of course, there's still probably that voice that's like, well, what if I didn't have it? You know, even if I,
Yeah,
kept,
right.
what if it
Yeah,
was for no reason because I just got, I'm lucky and I didn't
right.
have it, right?
Yeah, yeah,
But it's almost if you knew you were going to die from it,
yeah.
but you could do something about it, what would you
Right.
do? And you
Yes.
basically got the
Yeah.
opportunity to know that you might die
That's
from it
right.
by seeing
And
your
isn't
test
that the
results.
future? Isn't that
Yeah.
what we're supposed to be doing?
It's preventative
Improving
care.
risk reduction.
Yeah.
You know, if I have an 87% chance of developing breast cancer, and if this reduces that risk to say 45%,
Right.
that's good, isn't it? And if I had a 70% chance of ovarian cancer and this reduces it to zero, that's good odds. But I think it's harder for younger women to think of doing this kind of
Maybe.
surgery. I mean, I don't need my uterus right anymore. Um, so, like a younger woman who might be fertile and has not had children yet, that would be like
Yeah, I
huge
guess
to
that does
be
change
presented
your
with that.
perspective for sure.
Yeah, yeah. So that's when we got you tested to see if you carried the gene. We're all like jumping for joy when yours tested
I
negative.
was mentally preparing for, okay, if it is positive,
Yeah.
I should, seriously start thinking about having kids.
Right
Yeah.
away. Yes.
Like
Yeah.
that
I
probably
know
would have
I know a
completely
woman who's done
changed my
that.
life.
Yeah, absolutely.
Which
Yeah.
not for the worse. That would be
Yeah.
okay if it needed to happen sooner. But
Yeah.
now I don't have that kind of, I guess, pressure, that
Urgency.
less
Yeah.
urgency, sure.
Yeah.
Yeah.
Yeah. That's so great, Bridgie. Yeah. For me, I just want to get it over and done with and see when I can start doing my yoga again.
Right.
And not that I'm practicing hours and hours a day or anything, but when I do practice, um, it feels so good. When you get to this age and you're still able to do headstand and handstands.
Yeah. Yeah.
I don't want to lose my strength and
Don't
my
don't worry about
flexibility.
that though, because that is something that you
Yeah,
will regain, and you'll probably have
I hope so.
more attention to your body
Yeah,
afterwards, right?
yeah, yeah.
And maybe even get,
Yeah, I'm just not very good at being the patient. I'm
yeah.
sure I'm going to be a pain in the arse tomorrow. And I apologize to everybody who has to deal with me. I'm so lucky with the team I have. They're my friends.
That's true. Yeah, you know the
Yeah,
doctors and
yeah,
anesthesiologists like
yeah,
personally, which I mean that probably helps you make that decision
yes,
easier, of course.
yeah,
Do you feel comfortable kind of describing what will happen tomorrow? Or does it
yeah.
kind of,
I feel
I mean
fine
you do
with it.
intense surgeries and
Right,
procedures,
so
so
it's
if,
fine. Well, so it's in the same day surgery, so I'm hoping to go home after it. I wanted to stay awake and talk to you
right,
during it and make a podcast, but my doctor Crownover said no. He said it would be too uncomfortable because they have to put me to sleep because they're going to fill my abdomen up with air. And I guess that makes it easier to view the different organs that he has to work with because he's doing it laparoscopic with a robot. Um, so he'll detach the ovaries, the tubes, the uterus, and drop it, and the cervix, all of that drop down out through my vagina, my golden gateway. Same, same pathway
oh,
you came. Now the magical, mystical uterus has
so
to
do they
come
make
out the same way.
incisions?
Yes, he
Do
said
they?
just 3 little incisions, one around my belly button and two lower in the lower abdomen groin area. So they're tiny
Yeah,
little ones, like, yeah. Dr. Crownover, he said he was going to then send all those little bits and pieces to the lab just to make sure that there's nothing suspicious.
mm,
And also, we had this like wash that they wash everything, and then all of that wash is sent to the lab also to look for any cancer cells that might be in there. So
right.
that's great, isn't it? That's like really,
Does that
I'm going to
worry
get
you?
washed out.
Yeah.
Well, I hadn't thought of it until he said it, and then I was like, "Oh no, what if there are? What
Yeah,
happens then?" I hadn't gone there in my head because in my mind I was like, "This is preventing anything."
right.
Um, so
But I mean, it
I
can
I guess if
detect
yeah,
as
I'll be
well.
kind of sad if that's the
Yeah.
case. Yeah, I'll be like bummed,
Well,
but
you tell me.
I'll know. I'll tell you.
Good.
I'll be like, Bridget, my money's behind the.
Of course.
But did you know that death is not a scary thing for me. I don't I don't like think, oh no, what if I die? I'm not thinking like that at all. Okay.
Sure, but I still need you, and I'm not done with
Yes.
you yet, so.
And I'm not going anywhere.
Okay.
But if I did, you know how I'll be. I'll be like jumping out of my body, flying off into the abyss, very excited for the new adventure.
Yep.
I will.
Yep.
It'll be very interesting. And remember that death is safe, right? What can happen to you once you're dead? It's very safe.
Nothing matters.
I read a beautiful poem and I wanted to share it with somebody. It was actually from Thich Nhat Hanh, who I love.
Hmm.
See how on my wall always. Um, he said, "When I die, don't miss me. Um, I'll still be there. I'll be in the flower. I'll be in the bird song,
Mm.
and I'll be happy." Isn't that lovely? That's kind of just a shorter version of it. I must find that for you. It's really nice.
It is, yeah.
Yeah, yeah. But don't worry, I'm not going anywhere. But I'll probably be all puffy and puffed out my belly for a day or two. And
I've heard
I imagine,
it takes a lot longer. So
yeah.
be prepared to be a patient. Try it out.
Oh no. I'm just going to hide in my bedroom for
What would you
a few
tell?
days.
What would you tell a patient that's going through this surgery?
Oh,
Tell
okay.
them,
Thanks,
and then
Bridget. You're
take some
right.
of that advice.
Yes. I would tell them to rest,
Yeah.
but not too much. I would tell them to get up and walk within 12 hours of their surgery, and to drink lots of water. Try not to get constipated, not to get hooked on narcotics. Um, ibuprofen is a good pain medication too. And what else would I tell them? Just
When it's
to stay calm,
yeah.
not to rush to it. Like I was going to go to Ireland on Saturday. That had been our plan. We were going to like have the surgery and run off to Ireland and use the time recovering in fun places.
Right.
So we decided not to do that.
Right.
Yeah. We should use this as an opportunity to help other women who might have to have a hysterectomy. Women who are sick or scared. That maybe if I share my story, they will feel better about their own situation.
Or even if you know people in your family that have had those types of cancers, you can do a genetics test to see if you have a predisposition to also testing positive and having those same cancers. So that might be something that a preventative care could help, but you wouldn't know unless you get tested. You're not going to do it on anybody, right? I'm not going to get that for the same reason.
Hopefully, if some of my sisters and nieces are listening to this, I don't know if they ever will, but if they do, they'll get tested, and then they can make up their own mind if they need to do anything with their doctor. Yeah. But anyway, so I'm going to maybe leave it at that. I'm going to go and gather my thoughts and see what I need for tomorrow.
Yeah.
No, not a whole lot.
And just call me if you need anything. Thank you for kind of sharing it. And I know it's kind of a private thing to have to go through.
It's me bleeding truth. If ever there was bleeding truth, here it comes.
I wish you luck tomorrow. So
thank you.
I hope when we do the next recording, we'll be able to kind of share the good news that everything went well and and that you're healthy again and kicking.
All right, so we're going to wrap up this episode, and thank you so much for being there and listening to us. I really appreciate it personally, especially at this time. And if you like what we're doing, just hit the like button and subscribe. Again, it's free, it doesn't cost you anything, and it really helps us.
Thank you.
Thanks for being there. Thanks a million. Goodbye to the uterus party.
What are you gonna do?
What do we
will let you take it home?
Well, the TV just came on. People saying, talking to me like I'm a patient. I get on. There's a ghost.